through cases. I mean, I maybe just need to dispense with that because it's not really been rare. I think there's been a lot of people who've been vaccinated who've tested positive. Most of it is modest and mild, which is good. And at the end of the day, the purpose of a vaccine, whether on the front end or even a monoclonal on the back end, is really to prevent serious illness. I mean, if you have a mild fever for a day or two, then you get over it. Those are things that people live with. And so you do have people testing positive. Most of it's mild. Most of the people that progress to hospital admission are people that had not been vaccinated prior. It's also the case, talking with the health systems, of the people that get admitted for COVID, over 90% of them didn't get the monoclonal antibody either. And so I think part of it was just a lack of knowledge about this being available. For whatever reason, some people thought that this was something that was exclusive. Some people thought it was like super expensive, which is not true, at least the Regeneron. And so there's just different reasons. And so there wasn't as much knowledge. Now I think more people know about it. Obviously, more people have been able to do it, more positive results. People tell their friends and family that what happened, and so you do it. So it's here to be able to go. It is not a charge to the patient. You know, you hear people put out stuff saying that this is thousands of dollars. Now there's two other monoclonals. There's the Eli Lilly. Now that has not been proven to be as effective against Delta. Then you have one from GlaxoSmithKline, which is newer, and we think it holds up against Delta, but that's not one that the federal government has bought the stock of. And so that's there. You don't see a lot of that in the U.S., but to the extent you would, that would be something that would be like any other medical treatment in terms of cost. The Regeneron that we're offering here, federal government bought all of this last year, and so whatever's being drawn down was paid for long ago, and so the Florida is not being charged to draw it down, and then when the patients come in, they're not being charged for it when it's applied to them. And so don't let rumors or kind of false narratives about this being something that would be very costly to you dissuade you from coming in. You're going to be able to be treated with the Regeneron, and that's true. The GlaxoSmithKline, I think it's performed pretty well. I think people have had pretty positive views about it. It's a little bit different than the Regeneron, but that one is one that the federal government has not bought the stock for, and so it would be treated just like any other medication. And Dr. Shepke may weigh in about it, but we have not seen a lot of these systems offering it. Most of them are offering the Regeneron, and that's just been the one that's being used. So just understand it's available. It's accessible, and there's not going to be any financial considerations that are going to keep you from being able to access this. So we're happy to be able to bring this here in Sumter County. So we have, if you look at the central U.S. with it, I think people are happy to know that there's an option early, because we hear so much about a whole bunch of different things. We had not been hearing very much about this for many, many months, even though it was something that, we, from the very beginning, I mean, I was happy it was available and spoke with the hospitals, and they've been doing it the whole time, but it really had not gotten in, I think, to the public the way it should. Now I think more people understand, more people are using it, and we've had some really inspirational stories of people who were really high risk, who were able to come in and get the treatment, who are back on their feet and feel a lot better. And that's what it's all about, just help keep people out of the hospital, saving lives, and making sure that they have, and again, no one's forcing anyone to take this. It's your choice. You got to do what's best for your health, but just know there is an early treatment option that has a proven record of effectiveness. So thanks for the folks at the Villages. I saw Gary Lester here for making this facility available. And I think it's going to be very effective, and the word spreads very quickly here, so people know that if you do test positive, this particularly if you're in those high-risk groups, this is something that you can come in, you can get. It's very efficient the way they do it, and I think you'll end up seeing some good results here like we have throughout the rest of the state. Okay, I'm going to have Ken Shepke, as the Chief Medical Officer for the Florida Division of Emergency Management, come up and say a few things about what we're doing here.